There are lots of prescription and over-the-counter anti-inflammatory pain medicines, but which one should you take?
I'm Dr. Bill Fricks.
And I'm Dr. Sean Miles.
And we are two board-certified family physicians with over 20 years of experience apiece.
That's right. And we're going to talk today about some of the medicines that we prescribe and that are available over the counter.
One category of medication that we do a lot of prescribing of is anti-inflammatory medications, otherwise known as NSAIDs, non-steroidal anti-inflammatory drugs.
Not to be confused with the steroid medications.
Yes. So anti-inflammatory medicines.
Why don't we each name one? We'll go back and forth.
Oh gosh.
How about ibuprofen?
Aleve or naproxen?
Yes. How about diclofenac?
Oh, you took mine. Celebrex or celecoxib?
Celebrex, yes. Another one that I use a lot of is meloxicam, which is Mobic. I think those 5 probably are the most common ones that we use here.
So, do you have a favorite NSAID for yourself?
I like naproxen.
You like naproxen? Mm-hmm. I tend to like ibuprofen more, but we can talk about maybe some of the differences in a second. How effective are these medicines at alleviating pain?
Yeah. I used to not be a very big believer in them. I felt like anything that you could buy from the grocery store or the pharmacy was probably not legit. But after going through medical school, I thought, I'd give it a try. And so I'm a believer now. I think they are effective.
And I'll tell you, for me, just getting older, I know they're effective.
Yeah.
Get aches and pains that I didn't used to have.
I took some this morning.
Oh, yeah? Which one did you take?
I took some naproxen.
Naproxen, right? It's cute. It's a little blue pill.
It is a little blue pill.
I think the biggest thing that we want to talk about today is the safety.
Just because something can be bought over the counter does not mean that it's safe for everyone. I mean, generally speaking, they're very safe medications, but you do need to be on the lookout if you have certain medical conditions. And I think the one that we are concerned the most about would be somebody with a history of gastric ulcer or at risk of bleeding. Yes.
I think if we were to talk about the biochemistry involved in these medicines and how they work, that's where some of them can separate, because the ones that we use the most tend to be the ones that can cause the most injury to the stomach and digestive tract. When you're talking about that, there's some things that we can do to help prevent that.
Yeah. You may want to consider taking a proton pump inhibitor or something for prophylaxis to prevent ulcer formation like Prilosec.
One of the prescriptions, Celebrex, is one that tends to be safer for the stomach anyway because it only blocks one of the enzymes involved in the anti-inflammatory path. So I think that can be helpful too. Yeah, one of the big things that I worry about after the gastrointestinal effects are the kidneys. We need to keep our kidneys, and these anti-inflammatories can knock out the function of the kidneys if we're not careful.
If you suspect that you may have, or you've been told that you have chronic kidney disease, you really need to check with your doctor before you consider taking these medications.
So, if somebody does have kidney disease, what other medicines can they take if they have a pulled muscle or something?
I think the easiest one is Tylenol, which is often grouped in with these other anti-inflammatory medicines, but it's actually not an anti-inflammatory. It's just a pain reliever and fever reducer.
It's a good analgesic. It's strictly a pain medicine. It's not an anti-inflammatory medicine, but they are different medicines, and Tylenol can be safe for a lot of the things that we're talking about today when you can't take an NSAID.
What other side effects do you see with NSAIDs?
After Vioxx came out, which has been removed from the market due to some of the potential side effects from it, it really shined the attention towards cardiovascular side effects, things like heart attacks and strokes. And so we definitely want to be careful in those populations who are at risk for that. So if you have heart disease, had any kind of heart problems, I don't recommend really taking these very much at all.
I think in this study, too, that it was a risk for even people that didn't have heart disease, although it's a low risk.
Now, your favorite is naproxen, Aleve. Mm-hmm. I have read several studies where Aleve may have a slightly more favorable cardiovascular profile side effect-wise. So if you think you might be at risk for that at all, then I think Aleve might be the one to go with.
Yeah.
Is there an anti-inflammatory that maybe is more high risk for some of these people?
Yeah, we talked about this earlier. We talked about diclofenac. It may be a little bit rougher on the stomach.
Yeah, stomach, kidneys, and heart, I think, are all worsened by diclofenac more so than some of the other anti-inflammatories.
And you mentioned that the diclofenac, the oral, was maybe rougher. Is there another type?
There is, and this is actually available over the counter too, and that's topical diclofenac. But you don't get the same amount going through the body, affecting the heart, the blood pressure, the stomach, and the kidneys.
And you can take it with Tylenol.
Since we're talking about topical medicines like the diclofenac, there are some other ones that can be topically applied too, whether it's a patch or even over-the-counter creams. Now, we've talked about using these anti-inflammatory medicines for injuries, ankle sprains, muscle strains, things like that. What would you say as far as prevention of healing with these medicines? Because I've heard some things about that.
I think to get people back to their activity levels, I think they're helpful. I mean, I have read those studies too that said that they may impair some of the healing process, but if there's an effect, it's probably a relatively small effect.
Yeah, I think that the general thought for me is if you want to use them for a day or two after a big injury like that, that's fine. I don't think you're going to impair your healing that much. I wouldn't do it chronically, though, for an injury, because part of that's for healing. You need to let it heal and not block out all the healing. I think when it comes to chronic pains, that these are best used for exacerbations of the chronic pain, because I don't think anybody needs to be on an anti-inflammatory around the clock every day.
I think, if you need something, I think I would probably go and see your primary care doctor and talk to them about this. I would have some monitoring done. There are other medications that are better suited for long-term use. I know in back pain, a lot of times we'll use duloxetine or Cymbalta, and that can kind of cut down on how much of these medicines that you're using that can cause some of these issues.
But if I were, for some reason, going to be on it every day, one, I would protect the stomach like we talked about.
Yep.
Two, I would try to protect the kidneys by drinking relatively large amounts of water, because it affects the blood flow to the kidney, these medicines do. And if you're drinking extra water, you should be getting more blood flow to the kidney just so your body can get rid of the extra water. And if you're ever dehydrated, that is a terrible thing to do, is to take one of these medicines.
Is Diet Coke okay?
That's debatable. What is it with you and Diet Coke?
I love Diet Coke.
Is there any particular NSAID that works better for a specific problem? Like, should I take Aleve for my knee or ibuprofen for my head?
I think that's a very good question. I personally have not found to be that many differences. Although, if you look at some of the indications that have been applied for through the FDA, for example, like Vioxx, it had indications for headache, certain types of pain, dysmenorrhea, like menstrual cramps and things like that. And I think because they had those separate indications, people felt like maybe it was better for those than the average NSAID. But I think they're all pretty comparable.
Okay, so what's the recommended dose for these medicines? Is that something I can find on the bottle?
Absolutely. And I think that definitely you should go by the directions either your doctor gave you or what's on the bottle. You want to take the least effective dose that you can. That way you can limit your side effects.
So NSAIDs, anti-inflammatory medications, they're good medicines, they're effective, they're relatively safe as long as you don't have some of those contraindications that we spoke about, such as heart failure, other heart disease,
Kidney problems,
high blood pressure,
propensity for stomach ulcers, things like that.
liver failure.
So be safe. Thank you for watching, and we hope you can join us next time for another episode.